Welcome you all to the pharmacology lecture that is on corticosteroids. So it is direct extension of the topic that is the ACTH which we have just studied. Okay, so let's see the contents of my presentation. So the first point, that is the types of corticosteroids which are released by the adrenal cortex. Then second part is the pharmacology of glucocorticoids, and the third point is the pharmacology of mineralocorticoids. So today we will be only talking about the first point, that is types of corticosteroids which are released by the adrenal cortex, and we will see some introductory points like mechanism of action of glucocorticoids and the pharmacological actions of the glucocorticoids, and the rest of the things we will study in next lecture. Okay, so let's start the types of corticosteroids which are released by the adrenal cortex. Okay, so the adrenal cortex, it is divided into three zones which elaborate corticosteroids, that is the mineralocorticoids and the glucocorticoids and the weak androgens. So these zones are the zona glomerulosa. It synthesizes aldosterone and deso, desoxycorticosterone, which are nothing but mineralocorticoids. Then we have second zone, that is zona fasciculata. It secretes the cortisol, which is a glucocorticoid mainly. And the third zone, that is zona reticularis, it forms dehydroepiandrosterone, that is DHEA, and androstenedione, that is the androgens, and the traces of estrogens. Okay, so if we see the first two zones, that is the zona glomerulosa and the zona fasciculata, they are very important in view of the types of substances which are being synthesized and released by them. So the zona glomerulosa releases mineralocorticoids. These mineralocorticoids, as we know, they control or they regulate the electrolyte levels, and we have the glucocorticoids which are secreted by the zona fasciculata. Okay, so a corticosteroid with predominantly sodium retaining effect is called as mineralocorticoid, and the example is aldosterone and desoxycorticosterone. Okay, then we have second definition of the glucocorticoid, that is a corticosteroid with predominantly liver glycogen depositing and neoglucogenetic actions is called as glucocorticoid. Again, I will repeat, it is a corticosteroid with predominantly liver glycogen depositing. So one important function, that it deposits the glycogen in the liver. Okay, so glycogen, if you see, it is a storage form of glucose. Okay, and the new glucogenetic action, that means new glucose formation actions, they are facilitated by the glucocorticoids. And the examples of this, that is the hydrocortisone, cortisone, and most of the newer synthetic steroids. Okay, so understand, mineralocorticoids, they have sodium retaining effects, and the glucocorticoids, they have actions onto the glycogen storage and then formation of new glucose molecules. Okay, so next, let's start with the pharmacology of glucocorticoids. The important glucocorticoid which is secreted in man is cortisol, and it has some mineralocorticoid activity also. So the classification of the glucocorticoid, they we can classify them as per their duration of action, as short acting, intermediate acting, and long acting. The examples of short acting glucocorticoids are cortisone, hydrocortisone, okay, and of the intermediate acting we have the examples, that is prednisolone, methylprednisolone, and triamcinolone. Then of long acting we have examples, that is dexamethasone and betamethasone. Okay, so mechanism of action of glucocorticoids. So these glucocorticoids, they act by a complex mechanism which involves cytosolic nuclear actions and membrane bound receptors. Thus they produce genomic and non-genomic actions respectively. So understand what we have said over here, that there are two types of receptors onto which glucocorticoids act. One receptor is present in the cytosol, that is a nuclear receptor, and another receptor is a membrane bound, that is it is present onto a membrane. So when glucocorticoid binds to the cytosolic receptor, it produces genomic actions. Genomic action means related to the genes. And when glucocorticoid it binds to the membrane bound receptor, it produces non-genomic actions. Okay, so these glucocorticoids, they enter the cell as free molecules and they bind to the cytosolic steroid receptors. Okay, so the complex of the cytosolic steroid receptors and the glucocorticoid, it translocates to the nucleus. A translocate means it shifts from the cytosol to the nucleus, and the steroid, it binds to the glucocorticoid responsive element which is present in the regulatory region of the concerned gene. Okay, so if you see the receptor, it transports the glucocorticoid from the cytosol to the nucleus, and once it enters the nucleus, the steroidal part, it acts onto a specific responsive element which is present in a regulatory region of the gene. Okay, and this interaction between the steroid and the responsive element is responsible for the genomic effects of the glucocorticoids, and these genomic effects, they are executed through activation or repression of DNA transcription. Activation means simple as that, when it this interaction particularly activates or stimulates the DNA transcription, then we will get a protein from it. And repression means it is inhibition of, and if there is inhibition of DNA transcription, then there will be decrease in production of protein, or there is no protein production at all. Okay, so the repression of DNA transcription is believed to be responsible for the anti-inflammatory actions of the glucocorticoids, while upregulation of the gene transcription, that is stimulation or the activation of the gene transcription, which occurs with the higher doses of the glucocorticoids, they believe to cause the undesirable effects. This particular sentence is very important, because in many of the cases, like in COVID also, we had used dexamethasone. And what is dexamethasone? Dexamethasone is a glucocorticoid only, and as we know, in COVID, pathophysiology of COVID, there is a role of some inflammatory mediators. There is one terminology called as the cytokine storm. Okay, so to inhibit that particular thing, which is causing havoc into the lungs, we use the glucocorticoid like the dexamethasone. So in uh, liberal quantities, in liberal doses, these particular glucocorticoids, they are able to repress the DNA transcription. But if we don't control, if we don't regulate the doses of the glucocorticoids, then we will get harmful effects, and that harmful effects that will happen because of the upregulation of the gene transcription. Okay, so pharmacological actions, glucocorticoid, they exert a variety of physiological effects and pharmacological actions with supraphysiological doses. So those effects of the corticosteroids which involve concerted actions with other regulatory hormones, they are termed as the permissive actions. Okay, so let's see the first pharmacological action, and then probably we'll stop because it's a very big topic to study in one lecture. Okay, so the first actions, that is the metabolic effects of the glucocorticoids. So the glucocorticoid, they affect metabolism of carbohydrates, proteins, fats, electrolytes, water and calcium. So if you see, almost all biomolecules, they are covered, their metabolism is covered with the glucocorticoids. So we'll see one by one what effect does it have on the carbohydrate and protein metabolism. So the glucocorticoids, they inhibit the peripheral utilization of glucose by the skeletal muscle and the adipose tissue. So if you remember the drugs which we have just studied, that is oral hypoglycemic agents, they actually do the opposite of it. They actually increase the peripheral utilization, and glucocorticoids, they are inhibiting the peripheral utilization. Okay, so next is they inhibit incorporation of amino acid into protein in the peripheral tissue, which is nothing but its anti-anabolic actions. So if you see, it actually doesn't let formation of the protein in the peripheral tissue. Okay, then third is they promote conversion of amino acid to the glucose, that is neoglucogenesis in the liver. So if you see, with these actions, these particular drugs or the glucocorticoids, uh, they will actually produce harmful effects in the diabetic patients. Okay, how? Because one thing, that they are preventing their peripheral utilization of the glucose, and second thing, that they are actually promoting the neoglucogenesis. So both of the actions, they are actually unwanted or they are harmful in diabetics. Okay, so all of these actions, they help to maintain an adequate glucose supply to the brain. So you see that if there is lack of the glucocorticoids, then the survival becomes difficult. That's why it is said that the adrenal cortex part of the adrenal gland, it is essential to the life, and the adrenal medulla part, it is not. Okay, so as we know, the brain, if glucose supply to the brain it is stopped for uh, only 5 minutes, then there is loss of, or there is death of the neurons, it is taking place. So what these glucocorticoids are doing, they ensure that brain will get the glucose at any cost. Okay, so in sufficient quantities the brain should get the glucose to keep working, to keep running. Okay, so the plasma amino acid levels, they rise significantly due to the muscle catabolism. And simultaneously the plasma glucagon level, they also rise markedly during chronic but not acute administration of the glucocorticoids. Okay, so next is its effect onto the fat metabolism. So glucocorticoids, they play a permissive role in mobilization of fat from the peripheral fat depots by adrenaline and the growth hormone. Okay, permissive means they give a permit to mobilize, to shift the fat from the peripheral fat depots. Okay, and this action is actually facilitated by two of the hormones, that is the adrenaline, which is hormone from the adrenal medulla, and the growth hormone. Okay, so prolonged administration of excessive glucocorticoids, it causes redistribution of body fat with a loss from the extremities and its deposition in the neck, which is called as buffalo hump, and in supraclavicular area above the clavicle, and in the face, and thus giving the face a characteristic feature or characteristic appearance, that is of moon face. Okay, so this can be seen or this can be felt with prolonged administration of excessive glucocorticoids. Okay, so next on to the electrolyte and water metabolism. What effect does it have? The hydrocortisone, it has a relatively weak salt retaining and potassium wasting effect. However, when large doses are used, sufficient salt retention occurs to make the concurrent use of mineralocorticoid unnecessary. Hydrocortisone in 25 milligram, they have the same mineralocorticoid activity as 0.1 milligrams of the fludrocortisone. Okay, so on calcium metabolism and the bone, the effect it produces is that in pharmacological doses, the glucocorticoids, they antagonize the action of vitamin D on the gut, and they reduce absorption of calcium. This we have seen what role is played by the vitamin D. Okay, so large doses for prolonged periods, they may interfere with development of cartilage and inhibit linear growth in children. So due to protein catabolic action, the glucocorticoids, they inhibit formation of new bony tissue. The continuous resorption, which occurs as a part of bone remodeling, it leads to severe osteoporosis in chronic states of hypercorticism. So this is very important. Why it is important, I will tell. Because in asthma patients, we use the these particular glucocorticoids as an anti-inflammatory agents. Okay, so if these agents, they are consumed chronically, then they cause problems with the bones, and these problems are so severe that sometimes we have to change, or we have to do the some surgical procedures related to the bone. If you remember the head of femur that fits into the acetabulum cavity of the pelvic girdle, that weakness of it may develop because of continuous use of these glucocorticoids. So we have to do the surgical procedure and change that particular head and replace it with metal head. Okay, so such side effects glucocorticoids have, and that's why we need to use glucocorticoids very judiciously. Okay, so cardiovascular effects and further points in the glucocorticoids we will study in next lecture. So we should stop over here only. So I will just stop